wrong. Probably looks a lot like the one you remember.
Oh yeah.
But no, all those furry friends visits have been restricted in the pandemic.
It's got to destroy all the joy in life, huh? Seeing
right?
dogs walking around the hospital.
Now, I hope that you brought a picture of your family to share.
I did. I'm sorry. I could send you a picture afterwards if you want. Yeah.
I would enjoy that.
Okay.
Yeah. So how old are your kids?
So Audrey, our oldest, is 12.
Sure.
She's in 7th grade.
I'd start video.
I already did.
Oh.
Yeah. And Nora is 10 and she's in 5th grade. And then our 2 boys, Owen and Calvin, are 6 and 4.
Wow.
So yeah. So we got a fun group.
So did you do a holiday picture?
I don't think so.
No. I gotta reach out to Lindsay to find out the situation.
I have one. I don't know. All right. So yeah, I did think about that like 2 minutes ago that I should put a picture of my kids in, but I have some other stuff, so.
Okay. So where are you right now?
I'm in my office on lower level.
It looks pretty bright for being lower level.
Yeah, it's that opening that leads out to the street between Pomerantz and JPP. So I get like a sliver of sunlight comes through.
He's got windows.
So,
yeah,
I know. I missed that.
I feel super lucky for sure. All right.
Mike, if you were up here to our office, I don't think you'd recognize it. So we've lost most of our windows.
Since Tom's shop closed, I haven't been up there for a long time.
Yeah, I mean, why bother coming up there?
Why bother?
Right?
All right. So just time frame, Jelna. So I have a PowerPoint, but I was just planning on talking about my experience some. And then I just have some slides about work, like what type of stuff that we do. So how long do you want me to talk for?
Really, however long your presentation is, around 10, 15 minutes. I will, when you're done, ask questions that the volunteers have submitted. And
okay. So 10 to 15 minutes, not 2 hours or anything. Okay.
So I will give people maybe a couple more minutes to join, and then we will get started.
I see we got a lot of folks, a lot of board members there. Elliot, Katie, Emma. That's awesome. Looks like quite a few advisory board members too. So do you want them to turn their cameras on, Mike, or do you not care?
Cameras on is helpful.
Oh, hear that?
I do too much Zoom where you're just talking to your computer screen. It's really boring.
Okay, the challenge is on, everybody.
I don't have to, but
they'll probably call on you if you do, right?
I recognize a couple names actually.
That's impressive.
Yeah.
Like mine?
Yeah, Reed J there, yeah.
Oh yeah, Jilma said I should change that. Never did it.
Mine Nora Willey before because they're using this computer for Zoom classes.
So your kids in person now?
They're the part-time hybrid.
Yeah.
Well, they go to the Iowa City school, so they are either doing 2 or 3 days a week, but I think they're going to go 100% in 2 weeks is the word anyway. So
infection rates are looking better.
I think so. And I think the governor has a mandate now that all public schools are going 100%. So I think part of it is a mandate, but it will be nice. I mean, kids being home that much is bad for them and parents, I think. So
hard.
Yeah. So, but yeah, they're excited to get back to it. I think as everybody is, but
right, I think I will go ahead and get started here. So hi, everyone. We're so glad that you're able to join us for our first Lunch and Learn event of the year. Our guest today is UI Healthcare Orthopedic Trauma Surgeon, Dr. Mike Willey. Before Dr. Willey joined our healthcare team, he actually attended the University of Iowa and was an active volunteer and student leader board member. In the next half hour, Dr. Willey will tell you about his education, career, volunteer experiences, and then we'll answer some questions that were submitted by you last week. So Dr. Willey, thank you for joining us and taking time out of your busy schedule to talk to us today.
All right. No problem, Jill, and I appreciate the invite. It's kind of exciting to come back and talk to volunteer services because it was really a foundational experience for me when I was trying to figure out where I wanted to go with my career when I was an undergrad here. So I never imagined I would be giving a talk like this, but it's still pretty cool. So yeah, it's cool. It's cool to see faces, friends. Good to see Tom, Gene. Nice to meet you, Jelna. So I just put together a PowerPoint slide because I figured you guys didn't want to just look at my face the whole time while I was doing this. So I'll pull up that. If you have any questions or you can't hear me, please speak up. I don't mind getting interrupted during the talk if you have a specific question about what I'm talking about. So I'm going to share my screen. Let's see if it pops up here. All right. Gene, can you give me a thumbs up if you can see that? Okay, perfect. Okay, so as Jelna said, I volunteered here in undergrad before proceeding with my career here at the University of Iowa. Just kind of open for this talk. Just kind of the goals that I thought of this morning is that I wanted to introduce my experiences with volunteer services here at the University of Iowa, and how that led to my career in medicine. And then I just, have some interesting stuff that I do that I thought I would throw out there for you guys in case you wanted to see what type of stuff I do now with my career. So volunteer services was very important for me early on. I'm originally from Ottawa, Iowa, which is up by Sioux City. So I was originally from Iowa, and I had a really good physical therapist in my hometown that I'd volunteered with in high school, and really opened my eyes to medicine. And I knew that I wanted to do some career in healthcare. And my initial thought was that I was going to be a physical therapist. And he recommended that I came to the University of Iowa because they have a very good physical therapy program here. So I came to the University of Iowa with an interest in physical therapy. My girlfriend at the time and future wife, Lindsay, I think she probably introduced me to this. We both decided we wanted to volunteer at the hospital just to gain some more exposure to healthcare and, kind of help us decide what career we're going to go into. Early on, when I signed up to work through volunteer services in undergrad, I did physical therapy and the SICU. I think I was in the SICU first and did physical therapy later. But I started that pretty early on in my freshman year, just because I knew that I wanted to get that exposure, and it's kind of nice to get that break from school and work and things like that. So that exposure in physical therapy directly led to what my career was going to be in the future. So I was working in physical therapy. I met Mike Schaefer. Some of you might know him in physical therapy. Got to talking to him about what a career as a physical therapist would be like. He also recommended that I shadow Todd McKinley while I was an undergrad. Some of you, Gene, maybe ran into Todd when he was here. But he was a orthopedic trauma surgeon in this hospital. And Mike Schaefer, through that experience at volunteer services, set me up to shadow Todd McKinley who was an orthopedic trauma surgeon. And so I literally sent him a random email. He said, meet me on 5th floor of the hospital and I'll show you what I do. And so I met with Todd McKinley, spent the day in the operating room, completely confused and zero understanding of what was going on, but his enthusiasm, seeing how, excited he was to fix people up and get them back to functioning. It was, really led me to, as that goal to, have a similar career. So I continued working in physical therapy, shadowing Todd McKinley through undergrad. What I would say about those volunteering experiences early on is that it was a great introduction to the healthcare system. I think I'd had some exposure just to a small town hospital where I was from. And it was a good way for me to see if working in a healthcare system would be something that I would really enjoy. It's important to get exposure to patients and people that do these kind of jobs just to see how much you enjoy working in these situations. I think being a volunteer can be challenging sometimes because, a lot of your time is spent like waiting to be helpful, like trying not to get in the way of what's going on when you're still introducing yourself to what healthcare is. And I really appreciated help early on from the mentors and student leader board members, just educating you about how you could be helpful in those situations, because I don't like to just stand around and, it's good to have that guidance early on, just so you know that how you can be helpful in those situations. So after that, Lindsay and I decided to apply for the student leader board. I don't think Jean would have taken me if I wasn't dating Lindsay, but I was lucky and I got in. And I just remember that being an exciting moment, because I was excited to guide people through that program as other people had helped me through that process. And I enjoyed the process of coordinating volunteers and educating people about how they could be helpful. So I did patient's library with Mindy. I spent a lot of time with Mindy. She made me dress up like the man in the yellow hat from Curious George for like 5 days one week. And so that was great experiences. Mindy was great to work with because she really helps you guide you through that process. And patient's library, I really enjoyed going around and delivering laptops. I felt like that was a really nice service that they were able to provide for inpatients. So that was a really nice area to work in. I also coordinated the Ronald McDonald House, and I vaguely remember reading books to kids in the pediatrics clinic. I can't remember what that was, but I know that was something that we did too. Reach out and read. Was that what it was, Jean? Shake your head yes or no. Was that what it was? Yeah. So that was fun. So, so through my experiences in volunteer services, I was really able to introduce myself to what healthcare was, what the type of people were you'd be working with, what it was like to interact with patients. And I really felt like I was able to contribute just to giving people a better experience while they're staying in the hospital. So I really enjoyed it. Being part of the student leader board was helpful. Just leadership position is nice to have early on. And eventually I applied to medical school. Lindsay applied to the PA program here, and we both got in. I did medical school. I volunteered in the patient library a little bit while I was in medical school also. And eventually just, based on that early experience, really opened my eyes to orthopedic trauma and the good you could do for people. And so I eventually applied for a orthopedic residency. I got in at the University of Iowa, which is one of the best programs in the country. It's kind of sounds boring that every decision I made in my life, I decided to stay at the University of Iowa, but it was honestly always the best opportunity that I had. So I did undergrad here. I did medical school. It's one of the best residency programs in the country. So I decided to stay here. And once I finished, as I was finishing residency, Todd McKinley was actually leaving for another job in Indianapolis. So I had the opportunity to take his job when he left and continue doing orthopedic trauma, kind of circling back to that early experience I had through volunteer services. And since then, I did short fellowships in Indianapolis at Methodist Hospital, a big trauma center. I spent time in St. Louis at Washington University, and then I did a young adult hip fellowship in Bern, Switzerland. And so now my practice is equally split between trauma and young adult hip. So kind of half the time I take care of people with trauma, broken bones, do surgeries to repair those types of problems, and then also take care of people, young people with hip problems like impingement, dysplasia. And yeah, I enjoy my job, do a lot of research and improving outcomes in both those areas. And it's a fun time. So, so that's kind of just like how I got here, I guess. So that's what I do now, is I do orthopedic surgery here. So if you guys have any questions about that, I have some slides about what I do. I don't know if that's interesting or not, but I thought I would just buzz through some of that just because it's kind of gives you a highlight of what my job's like. So I do orthopedic trauma. So I take care of people that are in bad car accidents, fall off buildings, wreck their cars. This is a case of a 9-year-old girl. She was in a rollover ATV accident. I grew up on a farm here, so I know what that's about, little kids driving ATVs. So I'm definitely sympathetic to that population. She was a pretty badly hurt girl going pretty fast on this ATV. She had a big soft tissue injury here. You can see us in the operating room cleaning this up. She's got these really bad skeletal injuries. So these are pictures of her legs, x-rays. So you can see that there's a really bad broken tibia bone, her shin bone here on both sides, missing a ton of bone on this side. So we see these patients in the emergency room. We're cleaning up these wounds, getting on sterile dressings, reducing fractures, and putting on splints is kind of our early management of these types of problems. Where I come in on the surgical management, we're putting pins in the bone above and below these injuries, stabilizing these fractures, and putting in local antibiotics to help prevent infection. So a lot of my time is spent counseling families, talking to patients. You know, she's badly hurt, so I'm not directly talking to this patient, but speaking to families. And, you know, that early experience learning how to interact with patients when I was in undergrad, you know, it's all a continuum and a big learning process. And it all started with that. So we have to make difficult decisions about whether someone needs an amputation or if limb salvage would be the option, best option in this situation. You can imagine there's people with really bad injuries that do better off with amputation in these situations. But you know, cases like this, we generally try limb salvage, especially in a kid who's got opportunities to do, you know, pretty amazing things with healing these limbs. So we take her with a really bad soft tissue injury, ton of missing bone. I kind of specialize in doing ring frames to treat these problems. So this is a ring frame. So these are pins that go into the bone to stabilize this injury above and below. You can see this is a big defect in her shin bone, her tibia on this side that we start to fill with antibiotic cement. And then here's her other leg stabilized in a similar frame. And what we can do is a treatment called bone transport, where we actually cut the bone here, and gradually move the bone through the tissues as we regrow her tibia bone. So you can see the bone behind this part of the frame here has been cut. And here's that patient here standing up on her frame early after injury. This is really satisfying, getting people up and walking after these bad injuries. You can see here as we gradually transport this bone through the tissue, millimeter a day. Here she is at home in her frames that are stabilizing the fractures. And as we gradually move this through the tissues, we're regrowing bone as this moves through here. And eventually she starts to dock. This segment of bone has moved all through her tissues, and she's regrown this part of her tibia on this side. So here she is back. If someone's volunteered in our department, they might recognize our clinic here, but here she is walking in her frames. And then eventually these frames are removed. You can see we've taken this big segment of lost bone that we've moved through the tissues and regrown her whole shin bone. This is the front view, and then this is the side view here. So here she is standing up. We leave the leg a little bit short just so she has a better chance of healing that fracture. And here she is walking on it later on. And then here's Carly 6 weeks after we took off the frames.
Good. Come on back here.
Running good,
That's great.
happy. And then, right, here we go. Now she wants to run every time she comes back to clinic, so.
All right, now run away. That's funny. Oh, that's good. Give us a jump. There you go. Beautiful.
Yeah, so it's really satisfying taking care of these patients and seeing them. You know, she's in a really bad situation early on with bad open wounds, really bad skeleton injury, and you know, seeing these kids heal up, get back to function is really satisfying part of my job. So, and then just a little bit of a plug for our hip practice. You know, these are normal hips. I treat a lot of teenagers and people in their 20s with a hip dysplasia. About half of my hip practice makes up primarily hip dysplasia. So we get teenagers like this kid here. You can see normal hip, well-contained hip socket, where here he's got a dislocating hip joint, pretty bad hip dysplasia. We do a surgery called a PAO surgery to treat hip dysplasia, which is unique. There's only 3 or 4 centers in the Midwest that do that. So it's one of the advantages of working at a hospital like this and getting extra training is that you can, you know, learn how to take care of unique problems. So we do PAO operations for this. I work with an awesome team of biomedical engineers, that's headed up by Jess Getz. I was a biomedical engineering in undergrad here. And so kind of continuing that work through my career is cool. And Jess puts together cool things like this. You can see this is a hip before surgery. This is a hip with hip dysplasia after surgery. Red is high contact stress. So you can see before surgery, there's bad areas of high contact stress that lead to arthritis. And as we go through the gait cycle, moves bad through here. You can see we can normalize those forces after PAO surgery and help relieve pain, improve function in these people. So it's kind of cool that that goes together with my clinical practice, and we get to do research to really improve outcomes and help people take care of these problems. So this is kind of the primary core of our hip team. Jess Getz, who's our biomedical engineer, Robbie Westerman, who specializes in hip arthroscopy, is an excellent surgeon, Amanda Paulson, who's a physical therapist, and we've got just a ton of great nurses and residents that we help take care of our patients. So this is our team here. You can follow us, Hawkeye Hip Docs, and Robbie and my contact information here. So, okay.
Wow, that was awesome, Dr. Willey.
Sorry for the long talk if that was too
long. No, that was very interesting. And so I'm just going to ask a few questions that our volunteers have submitted. So one of them being, what prompted you to do a fellowship all the way in Switzerland after being in Iowa for so long?
That's a really good question. Can I stop sharing this, or what should I do here? There we go. Pause share. Oh, there we go. Thank you. So I was specifically interested in hip dysplasia during training. It was kind of an up and coming area in orthopedics. There's a lot of new treatments that have came about in the last 20 years and how we manage hip dysplasia in teenagers and people in their 20s. So it was a specific interest of mine during my training, mainly because there's just a big deficit in that area of how we take care of people, and definitely an area where we can contribute to improving outcomes with these problems. They developed the PAO surgery in Bern, Switzerland, and I knew that was something that I really wanted to pursue more training in. So I have excellent mentors here. Stu Weinstein, who's a pediatric scoliosis surgeon here at the University of Iowa, arranged for me to go spend time in Bern, Switzerland, primarily to learn indications for that surgery and how to perform that operation. So that was something that I was able to learn and then bring back here. And now we've developed, a practice where we take care of people from all over the Midwest, North Dakota, Colorado, Nebraska, Minnesota, Missouri. We get kind of people that fly in all over the place to be treated for that problem. So it's kind of an interesting area that I wanted to do research in, and was definitely a deficit we had. So that's why I sought out that extra training. So it was an awesome experience too.
I know you've kind of talked about one of your cases, but are there any cases that kind of stick out, or any experiences that stick out as your favorite throughout your whole career?
I would say as on the clinical side, taking care of patients like I presented there, I specifically chose that case just because it's very satisfying to take care of patients like that. She's like 10 or 11 when she's injured, and, a pretty devastating injury, really scared parents. It's implications for her function the whole rest of her life on how she heals up from this injury. And it's just very satisfying to take care of patients with those problems. It's a team approach too. Like we have Jody Buckwalders in our department who does all our soft tissue coverage for these bad traumas. We work with the general surgery trauma service. And so it's really a team approach, which makes it more fun. You're not just out there in isolation taking care of a small problem. You're kind of dealing with a big problem with multiple specialties. And so it's fun and satisfying, and that's kind of why I enjoy taking care of those patients. Other good experiences are working with residents. Is a really nice thing about working at University of Iowa, is that you work with residents and medical students that are really interested in what you do, and there to learn. And it's really satisfying to see people progress through that process, learn, and develop their own interests. So it's probably those are the two.
So what's a typical, I know this might be a tough question, but what's a typical day in the life of an orthotrauma surgeon like?
Yeah. I would say, just choosing to do trauma, you're kind of choosing a lifestyle that's a little bit unpredictable. You have to be comfortable with that. If you're going to do any kind of trauma surgery, orthopedic trauma, though specifically, sometimes, you'll go to sleep at night having no idea what surgeries you're going to be doing the next day. So you have to have a flexible personality in that way. So typically I get here, we have pass-on rounds. We have residents that are on call overnight. And so they stabilize patients that come in through the ER with traumas. And we have 3 trauma surgeons here that triage care for patients every morning. So either at 6 or 6:15 is when we do our pass-on rounds, where we triage care for patients, decide who's going to the operating room, and how specifically we're going to do fixation and treatment plans for patients. I operate 2 or 3 days a week, and operating room usually starts around 7:30 or 8:15. When I'm doing trauma, I don't know for sure when you're going to be done, just because you never know who else is going to show up. My hip practice is a little more predictable. We'll usually do 2 or maybe 3 hip preservation operations in a day. yeah, and we have a educational conference 2 or 3 days a week that happen after our pass on rounds in the morning. So it's usually 2 to 3 days of operating. I have a full day of clinic on Thursdays where I see in the morning only hip problems with Robbie Westerman, our hip arthroscopist, and our physical therapist, Amanda Paulson. And then in the afternoon, I see trauma patients. So I'm out at sports medicine clinic in the morning and here at the main hospital in the afternoon. And then I have 1 day a week that I do research, schedule research meetings, things like that.
I think we have time for maybe one more question. How have things changed in the face of this pandemic for you and your department?
Yeah, it's another good question. It changed a lot. You know, you always think things are going to stay the same, but it's kind of shocking how much of a wrench this can throw in the whole system. But trauma never stops. So, you know, even through March and April this year, and then in November and December when we had the surge, elective surgery was not happening here at the hospital, especially inpatient people that were staying in the hospital. So my elective hip practice was effectively shut down during those 4 months this last year. But, you know, they're just making sure the hospital's not too full and patients are usually understandable. Trauma never stops, but it really slowed down during this time too, with people not riding their motorcycles and ATVs and traveling much. It really, our trauma service did slow down a lot, especially during March and April this year. And, you know, it's seasonal. If it's too cold, we're not busy because people don't want to go outside. And if it's too hot, same thing. People don't want to go outside. So we kind of go slow. So we're kind of a nice weather service when people do dangerous things. But yeah, people, when people are on lockdown, there's definitely affects how busy we are with that practice. So.
Yeah, absolutely. Well, Dr. Willey, thank you so much for taking the time to talk to all of our volunteers today. I've definitely learned some interesting things, and I'm sure they have too. And to all of our volunteers, thank you for taking the time to be a part of our first Lunch and Learn of the year. You will receive a short survey just asking for your feedback for today's events and any suggestions you might have for us for future events. We appreciate everyone taking the time today, and thanks again for joining, and take care.
Cool. Thank you.
And then Dr. Willey, you should have a separate link for the private Q&A with the SLB.
So log out here?
Yep.
Okay.
Good to go.